If a young asymptomatic person has a mid-systolic murmur, it can be a benign murmur. While if a patient is having diastolic or a continuous murmur, even if the patient is asymptomatic, you must always investigate because a diastolic or a continuous murmur in an asymptomatic young person is always pathological. Thank you.
If hypokalemia is refractory to potassium replacement, always check for hypomagnesemia because in the absence of magnesium, the potassium you give will be lost in the urine via ROMK channels.
Amongst all causes of nephrotic syndrome, membranous nephropathy is the most notorious one for venous thromboembolism. So whenever you see a patient having membranous nephropathy and this patient is having serum albumin of less than 28 milligram per deciliter, always consider giving this patient a prophylactic anticoagulation.
Did you know that normal bilateral downgoing plantar does not rule out a stroke? While a unilateral upgoing plantar is a hard and strong neurological sign, stroke can still exist in the presence of bilateral downgoing plantars. The key points to remember are reflex limitation. While these reflexes help assess the corticospinal pathways, they are not definitive for stroke diagnosis. Number two, neurological signs such as weakness, numbness, speech difficulties, loss of coordination and loss of balance must be evaluated alongside these reflexes. Number three, the type and location of a stroke can affect the clinical presentation of a stroke. Some stroke may not lead to initial noticeable changes, especially if they are subtle or if they affect other areas of the brain. Number four, stroke symptoms can evolve with time, so continuous monitoring and re-evaluation is crucial. In short, always do a complete and thorough neurological assessment of the patient and do not rely solely on these reflexes.